South Africa, the massive civil wars that have occurred, the starvation, the enormous refugee camps, the malaria and tuberculosis that goes virtually untreated. Yes, there is no doubt in my mind that people are sicker in Africa and living shorter lifespans. When people get an AIDS diagnosis based upon clinical testing, they return to their villages to die. They basically give up all hope. They lose their will to live. They become outcast. They're rejected by their extended family, forced to live in a secluded, segregated little hut where they're given only meager amounts of food and water and prepare themselves for death.
What people don't realize about Africa is that life expectancy there has never been particularly long. To think that the arrival, shall we say, of HIV or AIDS in Africa has suddenly started shortening life expectancy in African countries is really contradicted by the evidence.
The media reports that 1,000 people a day die of AIDS in South Africa. It is a number with no statistical grounding, no evidentiary basis whatsoever. It is simply something repeated in the media. But if one goes and checks that number against the actual official statistics of South Africa, what you will discover is in 2004, in South Africa, a country of 46 million people, the total number of deaths that were attributable to HIV diseases was about 13,000. That's about 36 a day.
There has been a lot of death and disease and AIDS in Africa for many centuries. And again, our clinical tools and Western medicine penetrating some of these more remote corners of the world has allowed us to define a phenomenon that may well have been there for a very, very long time.
There was a study in the Journal of Infectious Diseases in 1994, for example, that made it quite clear that when they did these HIV tests on a population in Zaire, where there was widespread tuberculosis and leprosy, that the test results in 70% of the cases were false positive. If the test results are 2 or 3% false positive, a test is basically invalid. It's useless in terms of epidemiology. Usually these tests are conducted at a sexually transmitted disease clinic. Maybe 100 or 200 people are tested, or they're done at an antenatal clinic where pregnant women are also tested. And from those samples, then projections are made about the rate of HIV/AIDS.
The infrastructure, social and medical, is non-existent. Post-colonially, over all these 20 to 30 years now, 40, the services have disappeared. Malaria control, TB control. In areas like the Rakai in Uganda, there is no water that's clean. The pathogenic assault, the toxic assault of filthy water, malaria 11 times before you're 7 years old, diarrhea 7 times before you're 1 year old, makes your immune system very, very at risk and depressed. And if you test people with a severely challenged immune system, it is likely, according to the work of Professor Hessig and Eleni Eliopoulos now in Perth, that you will show antibodies that come up from the stress. And these antibodies are being called specific to HIV and are being called infected by HIV. I don't believe that. I believe they are auto-antibodies that are developed as a result of your body's immune stress.
One of the reasons that HIV is thought to be new in Africa is we have blood samples from the 60s that show no evidence of HIV. But the one question that journalists haven't answered is where that blood came from. And if you look carefully, it did not come from the same risk groups that we are now drawing blood from today and finding lots of HIV. It came from British school children in Uganda in a sort of the colonial time when Dutch and French and Brits were colonizing Africa.
If we're really honest, we would go back and we would do much more retrospective analysis, even go back 100 years, to find embalmed tissue, embalmed organs, and test them for HIV. And I think we'd be very surprised by what we would find. I believe we would find that both HIV and the group of infections known as AIDS are old phenomena found all over the world. Based upon my 25 years of research and massive interviewing, more than 3,000 physicians, scientists, experts, and activists on the subject of AIDS and AIDS-related illnesses, particularly how it was affecting Africans, there appears to be only one startling conclusion that I can reasonably come to, and that is, AIDS is not about a virus. No, it is about the untreated underlying diseases such as malaria, tuberculosis, malnutrition, and waterborne illnesses, including diarrhea and parasitic infections. It is about living in dire poverty and conditions of chronic civil war. It is about suffering the lethal effects of the AIDS diagnosis itself, including the harmful drugs that are prescribed in clinic after clinic where AIDS individuals are provided, however, with good nutrition and clean water and proper medications for underlying illnesses such as malaria. The vast majority of individuals return to proper health. But when AIDS individuals are severely compromised in their immune systems and are given the most lethal medications ever created, they do get sicker and they die. But their deaths and illnesses are then blamed on the HIV virus instead of the real illnesses underlying their AIDS conditions. More and more experts are agreeing on this view of AIDS, and yet this view has been suppressed as contrary to the financial interest of the AIDS establishment and its drug manufacturers. Isn't it time that we take a closer, unbiased look at AIDS in Africa and its real causes and real solutions? It's not possible in the limitations of this program to bring you everything about AIDS, but I'm hopeful that this at least gave you a second opinion, opened you up to a very controversial issue, and let you know that there are a lot of voices that should be heard, issues explored, and that is our intent. Thank you very much for watching.